Hi everyone, it's me again, Dr. Tansila Basrin, and right now I'm going to address some common facts and myths about COVID-19. As we know, we have been in lockdowns in various forms of isolation since, I guess, the beginning of the year. So let's talk about some of the common things that I often get asked. How does it spread? We went from needing regular surgical masks to N95s to all sorts of things in between. So it really is spread through droplets. What that means is that if I'm coughing or sneezing, all those droplets can be up in the air and land on you. And that's how you get spread. If I touch a surface where someone has coughed or sneezed and I touch my eyes, nose, or mouth, that's another form of spread. So the biggest spread is droplets. So no, you don't need to go get those N95 masks. A surgical mask will do fine. If you're in an indoor space, then I also recommend that you wear either a face shield or some sort of glasses to protect your eyes so that the droplets don't go inside. So let's talk about how to protect ourselves. We already talked about the mask and face shield and why that's important. But the other biggest thing and most important thing for you is to wash your hands. That means washing for 20 seconds to allow all of that bacteria and viruses and all that stuff to kind of fall off your hands. Otherwise, using hand sanitizer is important. I would say every third or fourth time, though, you should wash your hands with soap and water, because after a certain point, all of that sanitizer becomes stuck in your hands and can actually trap more viruses and bacteria instead. So in the hospital, our routine is every third or fourth wash should be with soap and water. Feel a little bit unwell. The number one thing to do right now is stop and self-isolate. If you find that you're having a mild sore throat or a mild cough, that is manageable at home without any shortness of breath or any other signs of an emergency, then stay home, stay isolated. We know that while 80% of people roughly do pretty well with just supportive care, there is another 15 to 20% who require hospitalization and even ICU admissions. So this means that the more you stay home, the less we spread. This also means that majority of people will do well just staying at home. So stay isolated, protect those around you, and take care of yourself by eating really healthy and staying well hydrated, and maybe some honey for your cough. You get tested. So if you have mild symptoms and you're able to stay home, it's not going to impact those around you, such as the fact that you don't live with anyone who has to work outside, or you're not with elderly, then just stay home, and I guess testing is kind of optional. If you find that your symptoms are impacting others around you, it may be important for you to know your COVID status. In this case, I recommend you go and get tested, and these guidelines do change every few weeks, so please look up your public health guidelines locally. The next thing I would say is if you feel short of breath, it's hard to breathe, you're feeling really unwell, your fever's not getting better with ibuprofen or acetaminophen, and it's been maybe a week or so and you're just not getting better, this is important to get checked out. You may even have another pneumonia, because while the pandemic's happening, other things being common can also happen. So at that point, maybe around that 1 week mark of not getting better, I really recommend that you go see preferably an emergency setting so that they can do x-rays and other things to make sure you don't have other conditions that we can actively treat. So what I'll say is Canada is pretty well equipped right now in terms of PPE, in terms of sanitizing products, and even our groceries. So should you panic buy? I don't think so. The biggest thing that's important for us to recognize is when we do go to the grocery stores, we should be masked up. And ideally, if you can, cover your eyes as well with either glasses or maybe a face shield. This will protect you from any droplets that may inadvertently be in the air. N95 masks, again, are not really recommended. Now, what I will say about groceries is make sure you're washing hands before and after picking up groceries and when you get home. Once you're home, I would really wipe down things or leave everything untouched for a few hours to inactivate most of the virus. I would look up online resources to see which kind of surfaces the virus lasts more in. And I won't go into too much detail about that right now, but we will have other infographics on that coming up later. In terms of groceries, try to decrease your frequency of visits. So that could be once every 2 weeks maybe, whereas you might have gone once every week, and that would be sufficient. Stocking up more than that can actually just impact your anxiety levels and really not be necessary. So make sure that you are decreasing your visits by shopping smart and shopping infrequently. As much. And the answer is, well, it depends. So the number one thing is for us to be socially responsible. The last thing you want is for your grandmother or your parents or someone you know who's immunocompromised to be exposed to someone who's sick. So if you're sick, absolutely, please do not go outside. We now have online grocery options, we have online clinic options, we have online almost all options. So decreasing the spread of this illness is absolutely paramount in conquering COVID-19. The next thing I would recommend is to kind of couple activities together. So if you have to do groceries and you can't do it online and you have to go outside for various appointments, do it all together and protect those around you and yourself. This means wearing a mask and making sure that if you cough or sneeze, it's in your elbow and not kind of in the air. Other things that I would recommend is having hand sanitizer with you when you're outside. And if you are coming inside from, let's say, the testing center or something of that sort, change your clothes, take a shower, make sure you're well clean, and really just take the right precautions to stay at home as much as you can. Last, the answer to that really relies on everybody, such as yourself. How well we maintain hand hygiene, how well we socially isolate, and how well we restrain ourselves from unnecessarily socializing and being silent and active spreaders of this condition is going to be reliant on us and our community. We need to protect our elderly, protect our immunocompromised, and really make sure that we are taking all of our necessary precautions. In terms of how to prevent it, other than our hand hygiene and staying away from droplets, really is the vaccine. When that vaccine is coming is really not known at this time, but we do know that there seems to be pretty good headway by various companies, and Canada is ready to take it as soon as it's available. The other thing about the vaccine is I know there will be so many myths and so many fears flying around. The one thing I will say is that Health Canada is quite diligent and usually very careful in terms of approving vaccines for efficacy and safety. So if it's approved in Canada, I would probably trust it. Other countries have their own processes, but I trust Canada's process. The next part I will say is this pandemic, though it may seem endless at this time, is really an important time for us to focus on the good things. The good things being spending more time at home, being mindful of all the luxuries that we've all maybe taken for granted, and also recognizing that there is a lot of blessings in all of this. We know that many people have learned to do more things with their family. They've learned to be home, get productive things done at home, and realize that a lot of our commutes and pollution and all of these other things that we do for the name of work is changing, and it's changing our landscapes and our way of functioning. While this can be good for some and bad for others, let's work together to make sure that we tackle this and not get a really bad second wave. The next question is about these waves. What does it mean to have a first wave and a second wave? What we know is all from data from the Spanish influenza that killed millions of people around the globe. We already know that the COVID-19 pandemic has killed over 1 million people and continues to do so every day. This is why it's so important to follow this advice and all the advice that all the doctors are giving about isolating. What we know is that the first wave is only the people who are immediately exposed. The second wave actually consists of a lot more affected people because now this virus is not just in our travelers, but also spread in our community. This means that it should rise exponentially if we go about our days without isolating and taking precautions. So please, 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 let's work together to flatten the curve once again until we have a vaccine and a solid cure for this condition. So to everyone at home, thank you for listening and for your patience. Keep going. We're a resilient community and we'll make it through this together. All right, have a good day and see you next time.